1 in 9. Just let that sink in for a second. 1 in 9. That is a staggering, sobering statistic. According to the latest National Cancer Center data, 1 in 9 men will be diagnosed with prostate cancer in their lifetime. It's the most common cancer in men, and yet somehow it is still surrounded by all these dangerous myths and outdated medical fears that could, quite literally, cost you your life.
So welcome to today's Explainer. I am absolutely thrilled you're here with us, because today we are tearing up the old textbook. Seriously, throw it out. We are bringing you the absolute latest, scientifically backed 2026 updates straight from top urology experts. We're talking revolutionary new blood tests, totally game-changing daily habits, and incredible new treatments that act like sci-fi homing missiles.
Okay, let's dive into this. Here is our roadmap for today. 1. The anatomical paradox. 2. The 2026 diagnostic evolution. 3. The do-nothing strategy. 4. The treatment revolution. And 5. Scientifically proven prevention.
Starting right off with Section 1, the anatomical paradox, and specifically, why you absolutely cannot wait for symptoms.
We really need to dismantle this dangerous misconception right out of the gate. So many guys think, well, I don't have any urinary issues, so my prostate must be fine, right? No. To understand why, we got to look at the plumbing. The prostate is this little organ, about the size of a walnut, sitting right under the bladder and wrapping around the urethra. Now, as guys age, the inner part of that walnut often swells up. It presses on the urethra, and yeah, that causes frequent urination. But here's the catch. That is usually just benign enlargement. The real danger is that 80% of prostate cancers form on the outer edge of the prostate. It doesn't press on your urinary tract at all. It just sits there, growing completely in silence.
And because it grows in silence, waiting for a symptom to show up is just a terrible strategy. Actually, by the time most men with prostate cancer feel a symptom, which, by the way, is usually bone pain in the hips or back because the cancer has already spread, it's way too late for early intervention. A shocking 30% of men who wait around for symptoms to appear already have cancer metastasis. So proactive checking, it is absolutely non-negotiable.
Which brings us to Section 2, the 2026 diagnostic evolution. We are finally moving past painful blind biopsies.
So how do we actually check for this stuff proactively now that the dark ages of painful, blind procedures are behind us? Well, this brilliantly illustrates our modern, hyper-precise diagnostic pipeline. Step 1 is still the famous PSA blood test. And hey, that test alone dropped prostate cancer mortality by 52% in the US. But a high PSA doesn't always mean cancer. So in 2026, we do not jump straight to needles. Instead, we move to Step 2, a newly approved, highly accurate blood test called PHI. If that one comes back high, then we go to Step 3, an MRI to visually spot the danger. And only then, at Step 4, do we do a highly targeted biopsy.
Let me tell you, this new pipeline is a massive relief. Back in the day, a high PSA sent you straight to a blind biopsy. Doctors basically had to go in and take 10 to 12 random needle samples. It was painful, and it carried a very real 2 to 4% risk of a serious blood infection called sepsis. And the absolute worst part? 70% of those high PSA results turned out to be false alarms, just caused by inflammation or harmless enlargement. This modern MRI and PHI pipeline completely eliminates that massive chunk of unnecessary pain and worry.
But there is a super fascinating and honestly pretty dangerous paradox when it comes to diagnostics and body weight. If you're obese, your excess fat actually converts male hormones into female hormones. And why does that matter? Because it lowers your body's natural production of PSA. The research shows obese men have their PSA levels artificially lowered by about 13%. That means a dangerous, aggressive cancer could be hiding right behind what looks like a perfectly normal test score. It's crazy.
All right, Section 3, the do-nothing strategy. Let's talk about the paradigm shift in active surveillance.
Okay, let's say you do go through the pipeline and you find a very early stage localized cancer. Your first instinct might be to demand aggressive surgery right then and there, but medical science has had a massive paradigm shift. Now, what's really interesting about this slide is a huge 15-year study out of the UK. They tracked 1,600 men with early-stage prostate cancer and split them into 3 groups. Active surveillance, which literally means doing absolutely nothing but carefully monitoring it, surgery, and radiation. Get this, the mortality rate across all 3 groups after 15 years was absolutely identical. The only difference? The side effects. The active treatment guys suffered from incontinence, erectile dysfunction, and bowel issues, while the surveillance group avoided all of that entirely.
See, early-stage prostate cancer is just incredibly slow-growing.
Medical professionals in the US actually call it the disease you don't die from. The 10-year survival rate for early-stage prostate cancer is nearly 100%. So if you or a loved one gets this diagnosis, take a deep breath. It is not an immediate death sentence. It is a highly manageable condition where avoiding side effects is often the #1 priority.
Moving into Section 4, the 2026 Treatment Revolution, the dramatically evolving care for advanced cases.
Now, of course, if the cancer is aggressive, if it's rapidly growing, or if it's started to spread, intervention is absolutely necessary. And the technological leaps we have today are nothing short of breathtaking. Traditional open surgery, which used to mean massive blood loss and long hospital stays, has been totally replaced by robotic surgery. We're talking pinpoint precision, minimal bleeding, and incredibly fast recovery times. We also have heavy ion therapy, which is essentially a sniper rifle for radiation, and it's now widely covered by insurance. And if the cancer has spread, we use hormone therapy. Prostate cancer feeds on male hormones, right? So by chemically dropping those hormones to near zero, we literally starve the cancer cells, causing them to shrink dramatically.
But what happens when the cancer mutates? What if it learns to survive without those hormones? For decades, that was the dead end. Until right now. Approved just recently in November 2025, radiopharmaceuticals are a total game changer. It is a smart drug injected into your bloodstream every 6 weeks. It acts exactly like a homing missile. It seeks out only the metastasized cancer cells anywhere in your body, binds to them, and releases radiation directly inside the tumor. It is so sci-fi that you actually emit radiation for a few days after the injection, and you literally have to stay a few meters away from your family. But man, it offers incredible hope and extended life for advanced cases.
Finally, Section 5, Scientifically Proven Prevention, how you can take control of your risk today.
We've talked a lot about medical interventions, but now we're moving into the empowerment phase of this explainer. What can you do starting today? Well, the crucial point is this magnificent number right here, 60%. According to Harvard University data, for men diagnosed with prostate cancer, engaging in just 3 hours of exercise a week drops their mortality risk by a staggering 60%. And if you don't have it, just 150 minutes of weekly exercise significantly lowers your risk of ever developing it in the first place. Your sneakers are literally medicine.
Next up is diet. We've got extensive data tracking tens of thousands of men over 17 years, and it heavily points to the traditional Japanese diet as being incredibly protective. It's all about strategic food choices. For example, loading up on soy products like tofu and miso gives you these amazing cancer-fighting compounds called isoflavones. And tomatoes? Make sure they're cooked. Heating them is this awesome biological hack that unlocks lycopene so your body can actually absorb it. Pair that with blue fish like mackerel to actively lower advanced cancer risks, and swap out your white carbs for brown rice or soba to keep your insulin levels in check.
On the flip side, there are things you definitely want to avoid. Western-style high-fat diets have been shown to increase risk by 22%. So to counter that, cut down on refined white carbs and, as we talked about earlier, do everything you can to avoid obesity, since that excess fat fuels those dangerous hormonal changes. And hey, here is a massive myth buster for you. Stop taking high-dose vitamin E supplements. Seriously, a major clinical trial called the SELECT trial proved that popping vitamin E pills actually increases your risk of developing prostate cancer. Just get your vitamins from real food, folks. And we absolutely cannot skip this incredibly fascinating, highly cited Harvard study regarding lifestyle habits. The data explicitly shows that men who ejaculate 21 or more times a month reduce their risk of developing prostate cancer by a full 20% compared to those who do it fewer than 7 times a month. Regular flushing of the prostate gland is a scientifically validated protective measure.
Which brings us to our final and honestly most important thought for today. We are living in an absolute golden age of medical advancement. Prostate cancer is highly preventable, it is completely manageable, and it is incredibly curable, if and only if you know it's there. Remember, you cannot wait for symptoms. So I just have to ask, armed with all this 2026 knowledge, when was the last time you or the men you love checked your PSA? A simple blood test is the ultimate key to a long, healthy life. Go get checked.